This is Dr. Corey Maas on Looking Your Best. I had two patients this week that asked me about permanent lip augmentation, and I wanted to comment on it. I've written a couple papers about this in the medical literature, and I feel very strongly about it. Partly because of those papers, I've had a number of patients referred over the years that have had permanent lip fillers. And while permanent fillers have a role, and I think they can be used in some areas very effectively, the use of silicone injections and Bellafill or Artefill, the products that are approved in the United States, although they are off-label uses in the lips, I think are too dangerous in terms of long-term outcomes and side effects to make them worth the benefit of not having to have to be retreated. Basically, these long-term fillers, and there's 57 of them now available that are permanent injectable fillers in Europe. So they are widely available there, but not often used there, and there's a reason, and that is that people can get granulomas, which are inflammatory nodules that can be really permanent in the lips, and they can be quite dramatic. It can make the lips hard and inflamed and very unnatural looking. I've had patients sent to me that have had attempts at surgical excision. I myself have done surgical excision of extreme nodules in the lips. And so these inflammatory granulomas are really an immune response to what the body perceives as a foreign body, a lot like if you were to get a thorn in your finger. It's in your lips, so we don't have a lot of wiggle room in terms of how it looks. And in fact, I've got patients that have tremendously over-volumized lips because those granulomas continue to form and they're just not controlled. Now, there are treatments for them, and I'm, again, not encouraging people to do this because you can treat them, but there are steroid injections and 5-FU and other treatments that we can use to try to calm that inflammatory response down if you were an unfortunate patient that decided to go with a long-term or permanent filler for your lips. But I would tell most patients that are thinking of lip enhancement to avoid the injectable fillers that are permanent. And again, there's only a couple of them in the US, and I'm not picking on them because I do think there are a role for those products in certain areas where they, in the worst case scenario, could be easily excised. The lips is not one of those areas. So my suggestion for people who want long-term volume enhancement or more vermilion, so see more of the red lip, what we call the body of the lip, or to go to the surgical options. And there's really three that I think of, and they are interrelated to one another. There's the subnasal lip lift, where the incisions are carefully hidden underneath or in the nostril itself and underneath the columella, the little piece of skin between the two nostrils, and up on the ala, the lateral nasal wall. That allows us to literally lift the lip up, which gives more vermilion show, and it gives it for the long term. It's a simple procedure. It can be done in the office with local anesthesia. I've got videos showing the procedure itself as well as before and after pictures, and it looks very natural and gives a great long-term lip enhancement. There are other ways to do it that you can't see the incisions at all because they're inside the mouth, and they're basically using some of the principles of surgery in terms of plasty. We call them labioplasty, if you will. One of them is the V to Y plasty or the W plasty, where from underneath the lip we'll make an incision in the shape of a V and then repair it in the shape of a Y, which allows the lip to move forward and roll out. And I've done combinations of the lip lift and V to Y plasty to get more fullness, more vermilion show, and better really white to red lip ratio. In the ideal world, you're in the 1 to 3 or better range. In other words, 1 part red lip to 3 or less of the white lip. And as we age, that white lip gets longer, no question. The subnasal lip lift actually really dramatically improves those ratios. The V to Y plasty improves the amount of vermilion or red lip show. So those are long-term solutions to be able to see more of the vermilion, the red part of your lip. And I can't stop the discussion of this without mentioning the corner of the mouth lift, because in many people, right at the corner of the mouth as we age, there'll be tissue hanging over the edge here, extending into the marionette line. And those patients are excellent candidates for what we call a corner of the mouth lift, which involves a very small triangular incision of that redundant tissue and actually elevating the corner of the mouth. And we're really trading off a deep line, that's the curvature of the so-called marionette line, or the crease in the corner, for a small and very difficult to identify linear scar that is diagonal and in the lip lines. And it's an excellent trade-off because it's very hard to see that scar and really gets rid of the sagging or downturned mouth, I guess is the best way to describe it. So for people really looking for longer-term options, I really advise avoiding permanent lip fillers and going to these surgical options: the subnasal lip lift, the corner of the mouth lift, the V to Y advancement. I'm not a big fan, although I've seen in certain cases that's a good indication, with direct lip advancement, which involves making an incision right along the border of the lip and taking out some of the white lip. I don't like that because that area, the lip roll area, is so sacrosanct. We don't want to do that unless it's a trauma case or some other special condition. I would stay with the subnasal lip lift. If you have any other questions about permanent lip enhancement or long-lasting lip enhancement, including those fillers that we don't advise, but the surgical options in particular, don't hesitate to write. You can send pictures of your lips that don't identify you so you can share them with other people and my thoughts on them. You can send those to drmaas.com. You can visit my website at drmaas.com or maasclinic.com to find out more information, see before, after, and after pictures, and learn a little bit more about these procedures that can really help you stay looking your best. This is Dr. Corey Maas.